I invite you to watch this movie. Now let us discuss further regarding HIV and AIDS, continuing from part 12. Any ordinary doctor cannot tell if the patient has HIV or AIDS. When he gets a positive HIV test report from the lab, he cannot differentiate between the HIV positive patient from the AIDS patient when this first test becomes positive. He should get a very expensive test to count the CD4 cells in the blood of the patient. The CD4 cell count test costs at least 1000 rupees to do. The test is not foolproof since the count involves very small number and requires special stain as well as a very good microscope. CD4 cells are of two kinds, B and T. B and T lymphocytes are the CD4 cells that look the same under an ordinary microscope. The examination of CD4 cells and their counting requires an electron microscope, which is very expensive, and the test is not affordable by an ordinary citizen. These procedures cannot be done in any laboratory that we are used to get our blood tested for other conditions. Also, the treatment cost of AIDS is very high. There is not one medicine that will be enough for AIDS, but 6 different medicines costing over 600 rupees or more every month will be needed all of the rest of his life. The medicine does not kill the virus completely either, so that we can say the patient is cured of the disease. The medicines only stop the progress of the disease from HIV positive stage to AIDS stage. To know if the drug is effective, the patient has to get another very costly test done, that is the viral count. Counting the virus in the blood is a laborious procedure and requires not only special equipment but also expert technicians. There is another danger. The HIV virus become resistant to these very drugs and the drugs become ineffective. So there is no point in taking the drugs at all. The medicine is not only not 100% effective, but it is also very toxic. The medicines will harm the liver, kidney or other systems. He may die of the complications of medicines rather than die of AIDS. So it is beyond any ordinary individual to either find if he has HIV and if he has HIV to get the proper treatment. An ordinary individual will totally ignore if he has AIDS or not. He won't care. The doctors have abdicated their right in applying their mind and wisdom in the correct management of HIV disease. The medical community has been hijacked by research scientists and drug industry as well as the government and agencies. These institutions have taken over the care and management of the HIV positive people. In my opinion, every HIV positive person should be considered to be normal until his CD4 and viral load is abnormal. Antiretroviral treatment drugs are prescribed if CD4 cell count is less than 500 and viral load is more than 50 copies per ml of blood. In my opinion, a doctor must refuse to prescribe ART to any person unless his CD4 cell count and viral load tests are abnormal. These institutions put out misleading advertisements in the media asking the people to discuss HIV and AIDS with their family. The advertisement is asking us to talk to our family. What does our family know about AIDS? We talk to our doctor when we have problems with health. Why don't you ask us to talk to our doctor, sir? There are advertisements which say that everyone should use condoms, as if the condoms will prevent our death from HIV. In reality, condoms do not help in the prevention of transmission of AIDS since they are worn only after foreplay and erection, by which time the virus is passed on to the partner. The use of condom is not an easy or pleasurable proposition. Also, the condom has a chemical non-oxynol on it, which can be harmful. How harmful it will be, I don't know. Because recently a rise in premature deliveries is seen. Does it have any relation to the use of condoms? More research is required to rule out non-oxynol as the cause of premature deliveries. Anyone using a condom is going against the nature. Nature will not tolerate interference in its process and course.